This 5-minute exercise routine can help relieve knee pain, improve function, and strengthen the muscles that support and stabilize your knees. You can follow along these exercises once or even twice a day to build strength and stability over time. The first exercise is a seated knee extension with or without resistance bands. This is meant to help strengthen the quadriceps muscle. If you have a resistance band, loop it around both of your ankles and anchor it with the non-working foot. Contract your quads to strengthen the leg. Hold at the top for 1 or 2 seconds and then lower back down. Now, some people will have pain when they fully extend their leg, and that's okay. You don't have to fully extend the knee to get benefits from this exercise. Go as far as your body will allow you to. We'll do this for 30 seconds on each side and try to aim for about 8 to 10 repetitions during this time. Okay, now let's switch sides. The quadriceps is one of the most important muscles that provides support and stability to the knee. Now, a little tip here, we actually want to target the VMO, which is the inside portion of the quads, and you can do that by rotating the foot slightly outwards about 10 to 15 degrees. The VMO is really important to target, especially if you have knee pain or if you have arthritis, as it helps stabilize the kneecap, control its tracking, and reduce stress on the joint. Try not to let your foot rotate too much inwards, as that can lead to worsening muscle imbalances. The next exercise is a bodyweight squat or a half squat, depending on what your body will allow you to do, and we'll do this for 30 seconds. Try to get 8 to 10 repetitions during this time. Stand with your feet about shoulder width apart and then turn your toes slightly outward about 10 to 15 degrees. Again, this outward angle helps to engage the VMO. Go down only as far as your body comfortably allows. Some people will need to start with half squats while others can go much farther down. Push through your heels to stand back up. The third exercise is a split squat or a mini split squat, which we'll do for 30 seconds on each side. Try to get 8 to 10 repetitions in during this time. Start by stepping one foot forward and the other foot back so that your feet are about hip width apart. Keep most of your weight on your front leg, that's the leg we're working on. Slowly lower your body straight down, bending both knees, and then push back up through your front heel. You should feel this in the front thigh and the glute of your lead leg. All right, now let's switch sides. If you have knee pain or limited balance, start with a mini split squat. Only go down just a few inches. And over time, as your strength and your confidence start to improve, you can increase your depth. Keep your torso upright, your front knee aligned with your toes, and avoid letting the knee cave inwards. This exercise is particularly important because it not only builds lower body strength and balance, but also helps address the side-to-side muscle imbalances that often affect people with knee problems. The next exercise is a straight leg raise. This is another excellent exercise to target the quadriceps while also putting minimal stress on the joint. So while lying on your back, bend one knee so that your foot is flat on the ground and keep the other leg straight. Tighten your thigh muscle to straighten the knee and slowly lift that leg up until it's about the same height as the opposite knee. Hold it there for a second or two, then lower it back down with control. Try not to let your heel touch the ground between reps. We'll do this for 30 seconds on this side and try to get 8 to 10 repetitions in during this time. All right, now let's switch sides. Focus on tightening your thigh muscle each time you lift your leg. If you can't fully straighten your knee, that's perfectly fine. Just go as far as your body allows. The straight leg raise, like the banded knee extension, targets the quads, but in a slightly different way. Instead of that dynamic up and down movement you get with the knee extension, this exercise works the quads more isometrically, meaning you're holding tension without much movement of the knee. It also emphasizes the rectus femoris rather than the VMO, so you're activating a different part of the quadriceps group. The fifth exercise is the side-lying leg raise. We'll do this for 30 seconds on each side, aiming for about 8 to 10 repetitions during that time. Lie down on your side with your legs straight and stacked on top of each other. Keep your top leg straight as you slowly lift it up about 45 degrees, then hold it for 1 to 2 seconds before lowering back down with control. Move smoothly and try not to roll your hips backward or forward. Keep your toes pointing straight ahead or slightly downward to better engage the glutes instead of the hip flexors. Okay, now let's switch sides. If this starts to feel too easy, you can make it more challenging by wrapping a resistance band around your ankles curls or adding a small ankle weight. The side-lying leg raise helps target the hip abductors, especially the gluteus medius. And when people have knee pain, it's common for the gluteus medius to become weak. And that imbalance increases stress on the knee joint, and that can make pain worse over time. So strengthening the gluteus medius helps keep the hips level when you walk. It helps improve balance, and it reduces the load that travels down to the knee. The last exercise is the glute hip bridge, which we'll do for 30 seconds. Start by lying on your back with your knees bent and your feet flat on the ground, about hip width apart. Press through your heels and lift your hips up until your body forms a straight line from your shoulders to your knees. Hold this position for 1 to 2 seconds at the top, and then focus on squeezing your glutes before slowly lowering back down with control. Try to get in 8 to 10 repetitions. If this feels too easy, place a resistance band around your thighs or rest a small weight on your hips to increase the challenge. The goal of this quick routine is to help activate and strengthen key muscles that provide support and stability to the knee joint. It can be done starting off once a day or even back to back, or maybe even twice a day, to maintain mobility, reduce stiffness, and promote long-term joint health. As you feel your body get stronger, you can add light weights or resistance bands to increase the challenge and continue building strength and endurance. The next video will discuss other evidence-based treatments that you can combine with these exercises for the best results.